After going to the emergency room one evening for severe stomach pain, Esha, a 36-year-old woman, is referred to a gastroenterologist. The gastroenterologist orders an endoscopy for Esha to evaluate what is happening internally to cause Esha to have abdominal pain. Today, Esha will have her follow-up telehealth appointment with her gastroenterologist to talk about the results from her endoscopy.
Hi, Esha. It's nice to see you. How are you feeling today?
Hi, Dr. Linares. I'm feeling well, thanks. I still have abdominal pain after I eat spicy foods or drink alcohol, so I'm anxious for my results.
Well, I have your results right here, and I'm looking forward to discussing them with you. I just wanted to confirm a few things about your medical history before we go any further. So, what is your age and have you ever been hospitalized?
I'm currently 36 years old, and yeah, once I had a stroke. That was 2 years ago, and I've been taking 81 milligrams of aspirin daily since to avoid future clots.
Do you have a family history of strokes?
No, but my mom and grandmother had heart attacks in their later years.
That makes sense. I'm glad you've been consistently taking the aspirin, but I also fear that it might have caused the symptoms of the abdominal pain that you're having.
Oh, really? That seems strange, because when the pain is severe, I take more aspirin and it goes away.
I see. Let's dive into the results. So it looks like you have peptic ulcers on your stomach lining, also known as gastric ulcers. These can occur over time with continued consumption of aspirin. While aspirin is great for reducing the risk of blood clotting, it also reduces your body's production of gastric mucus, and that can make it hard for your stomach lining to prevent ulcers from forming. We have a great drug that can help alleviate the symptoms of your ulcer while also allowing you to continue to take aspirin and prevent having another stroke. But before we talk about that prescription, we need to confirm you aren't pregnant.
Why would it matter if I were pregnant?
Well, in addition to helping your body produce mucus to protect your stomach lining, the drug we want to prescribe would cause softening of your cervix by activating the myometrium tissues in your uterus. If you are pregnant, this would cause the expulsion of the contents of your uterus, and you could have a miscarriage.
Oh, okay, that makes sense.
Yeah. So here's a cup for you to provide a urine sample. After we confirm you aren't pregnant, we will talk about a prescription for this great drug, Misoprostol. Thank you. Great news! You aren't pregnant, so I can go ahead and prescribe Misoprostol to help with your gastric ulcer symptoms and help your body rebuild the stomach lining. Let's talk about how Misoprostol works, because I'm a transparent doctor who prefers my patients understand the biochemistry of the medicine that I prescribe.
When your body is experiencing pain or inflammation, it releases signals via enzymes. Inflamed tissue signals a response of phospholipase A2 enzyme production, which converts phospholipids in the cell membrane into arachidonic acid. Arachidonic acid is a substrate for two enzymes, one of which is the cyclooxygenase or COX enzyme. The COX enzyme exists in two forms. One form that is active in your body all the time, and another form that is expressed at the site of tissue inflammation when you experience pain or a fever. The COX enzyme produces prostaglandins. What are prostaglandins? Prostaglandins are physiologically active lipid compounds made at the sites of tissue damage and/or infection, controlling inflammation, blood flow, formation of blood clots, and induction of labor. Prostaglandins help your body fight pain and inflammation, aiding the synthesis of protective mucus of the stomach lining and regulation of gastric blood flow in the stomach. When the pain is significant, you might take pain-relieving medication, like aspirin. Aspirin is an NSAID, or non-steroidal anti-inflammatory drug. These medicines reduce inflammation and alleviate pain by inhibiting the body's production of the COX enzyme. But NSAIDs inhibit the COX-1 and COX-2 enzyme production, decreasing the production of prostaglandins. This results in an increased risk of gastroenterological bleeding and peptic ulcers. Aspirin also inhibits the production of thromboxane A2 enzyme, an enzyme responsible for blood clotting. Thromboxane A2 inhibition prevents platelets from aggregating. Some people are prescribed aspirin for this quality, which can prevent blood from clotting and causing a heart attack or stroke. Patients with a history of blood clots may be prescribed aspirin for their cardiovascular health. In order to try to harness some of the benefits of prostaglandins, which have poor tissue selectivity, scientists have synthesized function-mimicking analogs of prostaglandins. An analog of prostaglandin E1 and prostaglandin E2 is misoprostol, which is prescribed to treat and prevent stomach ulcers by producing the prostaglandin that aspirin inhibits, thereby helping your body maintain its stomach lining mucus and gastric blood flow, a necessary part of avoiding stomach ulcers in patients like Esha.
Misoprostol is a methyl ester analog of PGE1. Carbon 1 on misoprostol is a methyl ester, while carbon 1 on PGE1 is a carboxylic acid. Esters are not able to form intermolecular hydrogen bonds and have a much lesser polar character than carboxylic acids. Misoprostol being more neutral than PGE1 will result in its passing the hydrophobic plasma membrane more easily than PGE1, making it an effective drug in the absence of naturally occurring PGE1. Following its passage through the hydrophobic plasma membrane, misoprostol is deesterified in the gastrointestinal tract into misoprostol acid. The deesterification of misoprostol dramatically increases its binding affinity. When compared with esterified misoprostol, misoprostol acid has a binding affinity 350 times higher at EP2, 40 times higher at EP3, and 250 times higher at EP4. Misoprostol acid also has equipotent binding preference at EP2, 3, and 4, compared with misoprostol, which has a binding affinity preference for EP3. The equally potent binding affinity of misoprostol acid at EP2, 3, and 4 results in poor tissue selectivity of misoprostol-free acid binding, activating other prostaglandin receptors and triggering tissues in the cardiovascular organs and central nervous system, causing adverse and potential risky side effects.
When taken, misoprostol travels in the body to find prostaglandin receptors, which it activates in the same way that naturally occurring prostaglandin would. Prostaglandin receptors are found on parietal cells throughout the gastrointestinal tract and on the stomach lining. The prostaglandin G protein coupled transmembrane receptors 1, 2, 3, and 4 are activated by misoprostol. When bound specifically to the third receptor, EP3, misoprostol induces an anti-inflammatory effect, reducing gastric acid secretion secondary to stimulation from acidic or spicy food, caffeine, alcohol, NSAIDs, and/or stress. Misoprostol induces mucus and bicarbonate secretion as well as edema or swelling of the mucosa and submucosa, thickening the mucosa bilayer, improving regulation of mucosa blood flow, and resulting in reduced backflow of hydrogen ions, ultimately leading to the preservation of the mucosa's ability to produce new cells.
Esha, do you have any questions for me? Are you still with me?
Oh, sorry, doctor. I'm still with you. This is bringing me back to my college days. Could you tell me how misoprostol actually gets into my cells? What is that called again? The molecular mechanism?
Great memory. You clearly study hard in college. Yes, let's look at the molecular mechanism right now.
Let's look more closely at misoprostol in the cell. Here, we have misoprostol bound to the prostaglandin EP3 receptor. Alpha helices are dominant in this secondary structure. There are 21 alpha helices in the receptor. Misoprostol is interacting with 8 of these alpha helices. Misoprostol is bound to the receptor using polar and hydrophobic interactions. Misoprostol acid binds to the receptor in 3 subpockets. The first subpocket is polar, consisting of arginine, tyrosine, and threonine. This subpocket forms a network of hydrogen bonds and ionic interactions with the acidic group of misoprostol acid's alpha chain. The second subpocket is hydrophobic and consists of glycine, tryptamine, leucine, valine, serine, and phenylalanine. This hydrophobic subpocket forms a single polar interaction between the alpha helix glycine and the hydroxyl group at carbon 16 on misoprostol acid. Finally, the ring on misoprostol acid interacts with residues of 2 threonine groups and methionine through hydrophobic interactions. The entire structure is an integral membrane protein, which means it is located within the phospholipid bilayer of the biological cell membrane. The extracellular portion contains beta sheets, while the intracellular portion consists of alpha helices. After binding, misoprostol acid's negatively charged carboxyl end brings together the residues from the N-terminus of alpha helices 2 and 7, closing the G protein receptor EP3 lid after its entrance. Let's look at some side effects of misoprostol. Because of misoprostol acid's poor tissue selectivity at binding, misoprostol is not recommended for use in pregnant people or people trying to become pregnant because it can induce labor and, as a result, cause an abortion. In the uterus, misoprostol acts as a prostaglandin E2 and binds to the EP3 receptors in myometrial cells, causing uterine contractions and cervical ripening. This leads to cramping, bleeding, and expulsion of the uterine contents. Although misoprostol is not FDA approved for use as an abortifacient, it is often combined with mifepristone to induce abortion. When used by people who are not pregnant or planning to become pregnant, misoprostol does still have some other common and adverse side effects. Talk to your doctor today to ask if misoprostol is right for you.
So, do you have any questions?
How often do I have to take misoprostol?
Wonderful question. For now, I will prescribe 200 micrograms to be taken every 6 hours with food. I know it sounds like a lot, but if you're not tolerating the drug at this dosage, we can always decrease it to 100 micrograms. I would like to keep you on this drug for 4 to 8 weeks to start. Because you take NSAIDs regularly, we may need to consider misoprostol being a long-term prescription for you. For now, let's see how your body reacts.
Wow, thanks for all this very thorough information. I'm so happy to have an understanding of how misoprostol will work in my body.
Happy to help. Let me know if you want to discuss any medicines you're taking. I love biochemistry.
I could tell, but no thank you.
Esha, are you still there?
Oh, I'm still with you. This is...
Oh, wait, I forgot. Sorry. Do you have any questions so far? Are you still with me? Okay. Okay, let's try again. Go back to the